हेलो फ्रेंड्स, वेलकम टू माय चैनल ऑल अबाउट नर्सिंग। आज मैं आपके लिए एक और नया वीडियो लेके आई हूँ जो कि मेडिकल सर्जिकल का एक टॉपिक है। काफ़ी लोग इसे एक्सप्लेन करना भूल जाते हैं, बट इट्स अ क्वाइट इम्पोर्टेंट टॉपिक। यू ऑल शुड नो अबाउट इट। सो दिस टॉपिक इज एक्लेसिया। तो एक्लेसिया क्या है, कैसे होता है, हाउ डज इट हैपन, व्हाट एक्चुअली इज द कंडीशन ऑल अबाउट? टुडे वी आर गोइंग टू लर्न अबाउट इट इन दिस क्लास. Atlasia is absent or ineffective peristalsis of the distal esophagus. अगर आप देखेंगे तो हमारा इसोफेगस का डिस्टल एंड मतलब मुंह से लास्ट वाला पार्ट जो कि हमारे स्टमक से अटैच्ड होता है, वो वाला डिस्टल इसोफेगस में पेरिस्टालिक मूवमेंट नहीं आता है। इसोफेगस का एक फंक्शन है पेरिस्टालिसिस, मतलब वो खाना हम जब मुंह में डालते हैं, गटकते हैं, वहां से हमारे पेट तक पहुंचाने के लिए एक मूवमेंट होती है जिसको हम पेरिस्टालिसिस कहते हैं। सो दिस पेरिस्टालिक मूवमेंट इज एब्सेंट इन द डिस्टल इसोफेगस, मीन्स जो इसोफेगस है जो स्टमक से अटैच है वो डिस्टल पार्ट कहलाता है, एंड दैट डिस्टल पार्ट डजंट हैव एनी पेरिस्टालिक मूवमेंट in this condition. Plus, this also have another problem, that is the relaxation is absent at the esophageal sphincter. So when you swallow, there is no relaxation of the sphincter. Sphincter is always closed or tightened and the food doesn't go inside the stomach. You can very well see this in the picture. Exactly what happened in Ecclesia? एक्लेसिया में क्या होता है? एक्लेसिया में आपका जो स्टमक और इसोफेगस का जो जॉइंट होता है, जो एरिया होता है, जो स्पिंस्टर होता है, एक तो वो खुलता नहीं है ताकि जो हम लोग खाना खाते हैं वो इट डजंट रीच टू आवर स्टमक. प्लस देयर इज डिक्रीज पेरिस्टालिक मूवमेंट, सो इट डजंट गो इनसाइड द स्टमक वेल, which henceforth results into the dilation of esophagus. अभी क्या है, esophagus एक नली है, it's a like a tube. So tube में if it will keep on, if you are eating, food will start accumulating in that tube. Once the food starts accumulating in the tube, it will start dilating, मतलब वो फैलने लग जाएगी क्योंकि खाना पेट के अंदर नहीं जा रहा है. क्यों? क्योंकि ओपनिंग खुल नहीं रही है या थोड़ी बहुत नैरो है. So it causes dilation of esophagus. And hence it results into dysphagia. Dysphagia means हमें खाते समय दिक्कत होती है, डिफिकल्टी होती है, पेन होता है. Symptoms and signs of eclasia. क्या होता है eclasia में? When your esophagus get narrowed, your food is not able to pass to stomach. What will happen? What symptoms will patient show? So these are the some of the symptoms what patient will show. फर्स्ट वन, डिस्फेजिया, खाने में उसको दिक्कत होगी, दर्द होगा, swallowing में दिक्कत होगी. सो दैट इज डिस्फेजिया. चेस्ट पेन बिकॉज ऑफ इंक्रीज एसिडिटी. देयर कैन बी अ साइन ऑफ रिगर्जिटेशन और बैक फ्लो, यानी कि हमारे उल्टियां जैसा भी लग सकता है और बैक फ्लो भी हो सकता है अगर खाना पूरी तरीके से स्टमक में नहीं जाता है. Then there will be a weight loss, heartburn. Because of increased acidity, there will be heartburn as esophagus will be exerting pressure on your chest area. So it may give you some cough or you may have an increased chance of aspiration. Usually when you people are sleeping at night, because of uh, because of dilation of esophagus, because of not and because of sphincter is not getting relaxed, the food accumulates in the esophagus, and when you lie down it is a chance that the amount of food you have eaten and the fluid will come back to the mouth, and in that case chances of aspiration is very much high. Let's see the clinical manifestations in detail. First one is difficulty in swallowing both liquid or solid. It can be seen in eclasia that person will have a difficulty in swallowing क्योंकि our esophagus is like a pipe, and when that pipe gets stuck with lot of content, it will be always difficult to swallow. It will be always difficult to pass off because peristaltic movement of esophagus are absent. Then comes sensation of fluid sticking in the lower portion of the esophagus. So we will always have a sensation. ऐसा लगेगा कि जैसे कुछ भरा भरा सा है. क्यों? क्योंकि खाना हमारे esophagus से stomach में नहीं जा रहा है. Because of narrowing of esophagus and non-relaxing sphincter. फुलनेस इन चेस्ट ड्यूरिंग मील. खाते समय हमें लगेगा भर गया है, क्योंकि हम लोग जब खाते हैं पेरिस्टालिक मूवमेंट से हम लोग का खाना सीधा इसोफेगस से स्टमक में जाता है, वेयर इट गेट्स accumulated as in bag. Okay, but अगर वो हो ही नहीं रहा, that process is not getting completed, in that case there will be chest pain, nighttime cough and additional manifestation. Chest pain can be severe because it's a acidity, heartburn are the causes, because increased level of HCl production will be in the stomach as we are not having food. If we will have food, it will neutralize that HCl, but as we are not having food, it will increase the acidity, which may result in chest pain. And as whenever we will be resting, as the food is in the esophagus, it will create pressure, hence there will be a chest pain. Then secondary pulmonary complication may occur if aspiration of gastric content happens in the patient. What all assessment and diagnostic findings are important in achalasia? Let's go and see that. So first of all is X-ray. X-ray will always show a dilated esophagus. Then barium swallow. Then comes CT scan of chest is necessary to see how much dilation and what is the content and how is our structure, esophageal structure. Then endoscopy and manometry. Manometry actually is a process in which esophageal pressure is being checked. Management of achalasia includes that patients are being instructed to eat less amount of fluid slowly, because it should get a way to reach stomach, and it is also being instructed to the patient that they should have their meal with a lot of water or with a lot of fluid intake, so that it helps to pass through the esophagus and reach the stomach. Then temporarily calcium channel blockers and nitrates are being given to the patient so that esophageal pressure can be reduced and improved swallowing can happen. Botulinum toxin, another way of managing achalasia. In this, injection is being given into the quadrant of esophagus so that it starts relaxing. It acts on the smooth muscle of the esophagus. This injection has to be repeated every 6 to 9 months in the patient with achalasia. One more way of treating achalasia is through pneumatic dilation. Pneumatic dilation helps, it stretches the area of the esophagus. It helps in the dilation of the esophagus. It is very successful and it is done by the balloon, inflation of balloon and then removal of head. But potential complication of this process is perforation. Lastly, management of achalasia is being done surgically by the procedure called as esophagomyotomy. In esophagomyotomy, the esophageal muscle fibers are being separated so that it relieves the pressure of the lower esophageal sphincter, or it relieves the esophageal sphincter. So these are the way how we can manage achalasia. So we have come to the end of the video. Hope you have liked the content and explanation. For more such video, do like, comment and subscribe my channel. Thank you.